Mhm.
All right, we will go ahead and get started in the interest of time. Thank you so much for joining us today. We are excited to have our cell series titled Diet and Lifestyle Guidelines for Prevention and Survivorship. And my name is Amy Thompson, the Cancer Survivorship Programs Manager with the Coalition. I will be facilitating this session along with Kristen Hackbarth, doing everything in the background for us. So thank you, Kristen. So first, we're just going to jump into a few housekeeping tips. As always, if you have any questions, just put them in the Q&A or in the chat box, and we will go ahead and address those questions at the end of the session in case Karen addresses them during her presentation. This webinar is recorded and slides will be available so that you can access those afterwards. And of course, if there's any connectivity issues, just hop back in and we'll pick up where we left off. So we're going to go ahead and launch a poll really quick. So we encourage you to take a few minutes to answer the questions that you see coming up on your screen. And I am going to happily introduce our speaker today. We are happy to be joined by Karen Fisicaro, a board-certified specialist in oncology nutrition with over 24 years experience working in health systems. She has experience working with all ages in all settings, and for the past 19 years has worked at Carson, Tahoe Regional Healthcare. And she is proud to have worked with her leadership team to build a dedicated nutrition program for their cancer center, which is a pretty big deal, and offers a full-time nutrition clinic for their patients for the past 4 years. So we're really excited to have Karen share her expertise with us today. So I am going to turn it over to you, Karen. Thank you.
Hello. Can you hear me?
Yes, we can. Thank you.
Okay. Well, thank you, Amy and Kristen, for having me. And I want to thank everybody who is attending on your lunch break today with me. I just wanted to first go over my learning objectives. And the first one is that I hope you, after the webinar today, you will be able to understand some of the evidence-based guidelines to reduce the risk for all cancers. My second objective is to help you learn practical strategies to optimize nutrition and overall health. And my third objective is to help you identify resources online to assist with ongoing education and support for nutrition and physical activity. Next slide, please. The first thing I want you to kind of understand is a little bit about the backgrounds of the guidelines. And so we have the American Institute for Cancer Research, and we have the World Cancer Research Fund, and they collaborate on expert reports. These provide the comprehensive summaries of the latest evidence, scientific evidence on diet, nutrition, physical activity, and cancer prevention. And this usually follows a systemic review where a panel of experts will evaluate and synthesize the available evidence from epidemiological studies, clinical trials, and other research studies. And the report's aim is to assess the strength of the evidence linking the specific lifestyle factors to the cancer risk. And as we go on, there's a continuous update project, which is an ongoing initiative that's led by the World Cancer Research Fund. And they also do reviews and analyze the global scientific evidence on diet, nutrition, physical activity, and cancer risk. And the goal is to then provide regularly updated recommendations for cancer prevention and survivorship. And the reason I like to point this out is because it helps you understand that there's an extensive amount of research conducted prior to the guidelines being established. And I think that's a really important point when you're talking to patients and clients, is for them to understand just how much data goes into building these guidelines. Next slide. So this is a great slide. And what I like about this is you can kind of see the patterns over the last 40 years. So since the AICR's inception, you'll notice that the research went from looking at single causes of cancer to now it's looking at a larger impact of the dietary patterns. And also now we're focused a little bit more on adherence to the recommendations. And so it's just a good slide to kind of show you that progress through time. Next slide. The research for prevention and cancer reoccurrence and outcomes is focused on lifestyle interventions because they are modifiable factors. We still have a lot to learn about how cancer develops, but these are the recommendations that will help us reduce the risk. They're not guarantees, but hopefully they can help light a path and help us guide us on our health journeys. It is estimated that 30 to 50% of all cancer cases could be preventable. But by following healthy diets and exercise guidelines and maintaining a healthy weight over time can help us to reduce our cancer risk. And I would also like to add that avoiding tobacco and wearing sunscreen and protective clothing is also a good cancer prevention recommendation that you won't see as we go on. But I think those are also important things to share with our patients. Next slide. So this slide shows the matrix summaries that the continuous update project shows judgments on. And it has to do with the strength of the evidence that's related to the diet, nutrition, and physical activity against the risk of cancer for each of the particular cancer sites. And it's also reviewed based off of weight gain, overweight, or obesity. And the evidence is presented by outcome and by exposure. It shows judgments on convincing, probable, limited, and suggestive. The judgments of convincing and probable are the ones that they feel strong enough to support as a recommendation, while the judgments of limited suggestive are not generally considered a recommendation. So the cancer prevention recommendations are based off of a synthesis of multiple data. And if you want, I created a little QR code and you can go into each of the different areas of cancer site and you can kind of see based off of these color codings at the bottom, you can kind of see the red is the increased risk, convincing increased risk, and then a probable is the orange, and then yellow is the limited suggestive. So if you wanted to kind of look and see in, with mouth, pharynx, and larynx, you could look and see according to the colors, kind of where the research lies with each of those. So it's kind of a nice slide to look at. Okay, next slide, please. So after they do all this research, they came up with these 10 recommendations. And so these are all the recommendations that you'll see. And I think this is a nice picture that kind of walks you through each of those recommendations. And what the AIC recommends is that the lifestyles that are more closely aligned with following these recommendations is generally associated with a lower cancer risk. And then I would just say better overall health. And this should be your blueprint that you're looking at when you're trying to reduce chronic disease and specific to oncology. Then you don't have to react to all those news medias that give you information that could maybe mislead you in the wrong direction. So the objective here is that you want to compare your current habits or your patient or client's current habits to this blueprint, and then you find the areas that you need to strengthen and prioritize for action. So we'll break that down here in the next slide. Next slide, please. So the first recommendation on there is to be a healthy weight. And that's because there is some convincing evidence that too much excessive weight from body fat and weight gain are important influences on 12 different cancer types. Next slide. So why does the excessive weight and obesity have a role in cancer risk? And that's because fat tissue is active tissue and it produces estrogen, and that can produce cancer development. The fat tissue also produces signaling proteins. They're called cytokines, and those can lead to chronic low-grade inflammation. And then finally, the extra body fat can lead to insulin resistance, which causes the body to produce increased amounts of insulin and growth factor that can lead to cancer development. Next slide, please. So weight, yeah, that's a big one, right? So that's a very complex topic, and we could probably do an entire lecture just on weight. But I wanted to keep it simple for this lecture, and I want you to know that there are a lot of things that kind of contribute to weight and our body composition too, I would add. These can range from our social determinants of health, our genetics, our health conditions, medications, of course, diet and eating patterns, and our physical activity levels. And then finally, sleep actually can impact our weight as well. Next slide. So I just wanted to talk a little bit about what factors that we can do to influence our weight, and then what are some things that we can't really control, right? So this is the whole point of the modifiable factors in lifestyle, because there are going to be things that are going to be out of our control. So when we talked about weight, on cancer and how 30 to 50% are linked to some of these modifiable factors, we have to always remember that there are things that we just don't know about cancer yet. And so those are things that we need to be talking to our patients about, because we don't want them to feel uncomfortable or blame and shame themselves because they got cancer because maybe they ate the wrong foods or didn't exercise enough or those kinds of things. So I think this is an important slide to look at and study a little bit. What we can control is we can consider choices to help us maintain our weight, and we can try to focus on healthy diets that aren't restrictive diets. And we don't want to be on diets that are going to promote a cycle of weight loss and regain, because that's not good for the body either. And then we can also consider some stress reduction behaviors. We can look at our movement and exercise. We can maybe do some cognitive behavior therapy. We can work on our mind-body techniques, or maybe we can work a little bit on our sleep routines and just get a little bit more sleep. Next slide. Sometimes the other thing we need to remind people is that we don't need to have huge weight loss in order to see a health benefit. So for people who are overweight or obese, even modest amounts, 5 or 10%, can help produce a health benefit. Those can improve with blood pressure, cholesterol, and blood sugar. And there also has been some research that for breast cancer survivors, even achieving 5% or greater weight loss can demonstrate a significant improvement with insulin resistance. So I think this is important because we want to make sure that, again, we don't want to go back to that shame and blame because people aren't able to lose weight. They can still lose a little bit of weight and follow these healthy lifestyles, and we can still have really good health outcomes. And then the other thing that I would also add here is A good goal, if you're already at a healthy weight, is to try to avoid weight gain. So those are just important things to share with your clients and patients. Next slide. The second recommendation is to be physically active. Exercise should be looked at as medicine, and it's recommended that we have some daily movement. So we want to, some of the benefits of physical activity would be that it can help build your immune system. It can help reduce that chronic inflammation that can be increased as we get older. It can help with hormone control, and all of those things can help reduce the risk of cancer. A couple of other things about physical activity is it does help improve your mental health, and it also helps you maintain muscle mass, which as we age, we are naturally losing. So those are all the main reasons why we want to be physically active every day. Next slide. So the recommended goal for physical activity is 150 minutes per week for moderate physical activity. The suggested amount would be about 30 minutes, about 5 days a week. And the main goals to consider is to kind of start where you're at. If you're not an everyday exerciser, maybe you just start and get going. And even if it's starting at 10 minutes, and then every week you add 10 or 15 minutes until you can reach your goal, then that's a good recommendation. You just have to get started. You could schedule time for your exercise. You could recruit a friend or take a fitness class. Some way you got to hold yourself accountable to do this physical activity. But I think the most important thing that I usually share with my patients is to always do an exercise that you enjoy doing. And then we also need to consider that some people have physical limitations. And so we need to be recommending movement that people can physically do. Because if you give out recommendations for physical activity and they can't do those, they're not going to stick with it. So those are things that we want to be thinking about. Next slide. So I have found a few web-based physical activity resources over the last year. And so I just wanted to share a few of them with you, and you can go on their websites, and some of them have some exercises that patients can do. So if they're not able to join a gym or a club or attend a group class in some way, then maybe a web-based resource would be good for them. So there's two Unstoppable, there's Innova, and then I've also have seen a few good resources on the National Institute for Aging, and I just wanted to share a few of those with you, so you have some other options for your patients or clients. Next slide. So the next recommendation is to eat a diet rich in whole grains, vegetables, fruits, and beans. There is really no single food that can protect you against cancer by itself. We really just need to be getting in a variety of foods. And plant-focused foods tend to be higher in fiber and nutrients and all those phytochemicals that help us naturally fight against cancer and reduce our risk for cancers. So this is the most highlighted recommendation, and the one that I'm probably the most passionate about, as you can imagine. Next slide. So one of the easiest ways you can teach people about a plant-focused diet is to just get them to emphasize fruits, vegetables, and whole grains on their plate. So if you can get a patient to visualize a plate and 2/3 of that being whole grains, fruits, vegetables, and beans, And then the other third of your plate with a lean meat source like seafood, poultry, or a dairy product. We only occasionally want to put lean red meat on there, and we'll talk about that later. And then you want to aim for 3.5 to 5 cups of fruits and vegetables a day. And then, as always, we always want you to eat the color of the rainbow, because they all have different nutrition. They all have different vitamins and minerals. So we want to make sure that we get a variety in our diet. Next slide, please. So the next recommendation is to limit our red meat and our processed meat. Red meats can best be described as pork, beef, lamb, veal, deer, buffalo, and elk meat. And I like to describe this one to my patients with the reference of any animal that walks on 4 legs. So a lot of my patients always come back to me. I always remember that. So hopefully maybe you could use that as you're sharing out nutrition and guidelines. We also want to be minimizing and avoiding any processed meats, and those would be all the bacon, sausage, hot dog, anything that's smoked or cured. Other words you could look for is nitrate. Those are the things we want to be minimizing. Next slide. So the recommendation from the American Institute for Cancer Research is to limit your red meat consumption to less than 12 to 18 ounces per week, or less than 3 portions per week. And then again, to minimize or avoid processed meats altogether. I like to share that maybe you could encourage your patient or clients to do like a meatless Monday challenge, or maybe think beyond a meat source a couple of times a week and just encourage them to find some alternative protein sources, because usually they end up being plant-based. So next slide, please. The next few recommendations, I thought I would just kind of summarize into one slide. And this recommendation is to limit any processed foods that are high in fat, salt, or simple sugars. This definitely includes your sugar-sweetened beverages. And the reason is because the consumption of fast food and processed foods are associated generally with a higher amount of calories. And the added sugars and the simple sugars that we find in our processed foods can cause spikes in our blood sugar levels. Examples of these processed foods would be fast food, your breakfast cereals, chips, desserts, candies, packaged foods, and sodas. Next slide, please. So the recommendations are to limit your sodium intake to less than 2,300 milligrams per day. That is about the equivalent of 1 teaspoon a day. We want to be limiting our fast food, fried foods, and foods with added sugars. Nowadays, if you look on the back of your nutrition label, the manufacturers have to list added sugars. So the recommendation is for less than 10% of the total daily calories. And if you're a grams kind of person, the American Heart Association says about 30 grams a day, because they do pull it out in grams. So that might help you when you're looking at added sugars to help you minimize those. You want to be trying to avoid processed foods, and you want to be looking at labels that say no added salt or low sodium options. You want to choose your whole grain foods such as oatmeal, brown rice, barley, things that say 100% whole wheat bread. Next slide, please. Other recommendations would be, if you enjoy carbonation of sodas, maybe you could try unsweetened flavored sparkling waters. You could try a variety of unsweetened teas. Maybe you could add in a mint leaf or fresh ginger or a fresh piece of fruit in there to give it a different flavor. You could all do those same things just with regular water, with citrus, or just throw a cinnamon stick in there. just give the water a little bit different flavor. And then if you're looking for something hot, some things you could consider would be cinnamon or cardamom in your coffee, or maybe steaming some soy milk and using some vanilla extract and adding it in your Earl Grey tea, and just trying to get away from all the extra simple sugars. Next slide, please. So this next one, people aren't always fond of when I talk about this one, but the recommendation from the American Institute for Cancer Research is that it's best to not drink alcohol at all. And there is alcohol intake is linked to an increased risk for certain types of cancers, and those are breast, colorectal, and liver cancers. And the AICR says there's no safe amount of alcohol that does not increase the risk of at least some cancers. So to reduce the risk, they recommend to not drink any alcohol at all. If you are going to drink, then their suggestion is to follow the national guideline, which is no more than 1 drink a day for women or 2 drinks a day for men. And the reason for that is alcohol is a recognized carcinogen, and it may increase cancer risk by making it easier for other cancer-causing compounds, like such as tobacco smoke, to get inside the cells and cause that DNA damage. When the alcohol is broken down in the body, the compounds form that can directly damage the DNA and lead to cancer. So that is why they give that as a pretty strong recommendation to avoid cancer or alcohol for cancer reduction. Next slide. The next recommendation is to choose food over supplements. The American Institute for Cancer Research recommends to not rely on supplements for cancer prevention. It's not a recommendation necessarily to avoid the supplements altogether, because sometimes there are certain situations where we need to supplement a patient if they have a deficiency. But for just overall cancer prevention, there's not enough available research to support that. So they do recommend to try to get that rainbow of food, and really focus on whole foods and plant-focused eating. And if you do that, you should be able to get all of your nutrition without feeling like you have to supplement. And the other thing that I will say about treatment, I know we're not kind of focused on that, but since that is an area that I work in, some of the botanical supplements can interfere with cancer treatment, and they compete with the same shared pathways with drugs. And oftentimes patients are on a lot of medications. So you really have to be careful with some of those supplements that you're taking, and make sure that they're not competing or increasing or decreasing the way a drug is working. So we always want to be pushing food over supplements. Next slide, please. So again, the recommendation is to eat a variety of colorful plant foods from each of the different food groups. I already mentioned that. And if you really are concerned about not meeting your nutrient needs, you could talk to a doctor or dietitian. I would even say a pharmacist might be a good person to talk to about possibly supplementing, especially if you have you haven't been eating well lately, or maybe you have trouble swallowing, or maybe the nutrients aren't absorbing if you're having some other symptoms. So there are situations where we do want to supplement people, but we really need to look at the labs and decide before we just make recommendations. Next slide. So I thought I would also share with you a few tools. Sometimes you're not always going to have the answers to all of your questions. And so I really recommend the American Cancer Institute for Cancer Research, and they have got 2 really great tools on their website. And the first one is the health check. And the second one is the Healthy 10 Challenge. And you can do this yourself. You can recommend it to your clients and your patients. But the health check just will compare your current behaviors to the 10 prevention recommendations. And then the Healthy 10 Challenge is actually a 10-week interactive program where they'll send you an email that will help you build some smarter habits so you can eat better and move more. Next slide. Before I close out, I was just going to cover a couple of cancer myths that I get asked often. And the first one I was going to cover was, does sugar feed the cancer? And I'm hoping that after I've shared the earlier in the lecture, we kind of talked a little bit about sugar and we talked about plant-forward diet. So I'm hoping you can form your own conclusions here. But what I wanted to point out is that sugar is not a carcinogen. So it's not going to cause cancer directly. But there are a lot of studies that show that the high sugar consumption is also linked to fat accumulation in body tissues where it doesn't belong, and specifically the liver and the muscles. And a high consumption of these sweet drinks is generally associated with a higher body weight, which then increases the risk for certain cancers. And also remember that the sugar leads to inflammation and elevated circulating insulin, which can lay the groundwork for cancer to develop. So for now, the direct link between sugar and cancer is not based on any strong evidence. But what you want to be focusing on are the complex carbohydrates. Again, that plant-focused diet, fruits, vegetables, and whole grains will also turn into sugar. But that's where we get all the valuable nutrition we need. That's where we get our fiber, our antioxidants, and all those other phytochemicals that we need to fight cancer. So the research shows potential benefit for all those complex carbohydrates for reducing cancer risk. Next slide, please. So this myth we also get asked about, and should we be avoiding soy foods after breast and prostate diagnosis? And this one, early when we were studying these, what we failed to help people understand was that there's a difference between estrogen and the isoflavones. So the isoflavones are the natural plant compounds that are found in your soy foods, and their chemical structure is pretty similar to estrogen, but they bind to the body's estrogen receptors differently and they function differently. So there are a lot of consistent findings from our population studies that indicate no increased risk for breast cancer survivors who consume soy foods. And in fact, there's some limited evidence that shows the potential for greater overall survival and perhaps a decreased reoccurrence among women a year or more after diagnosis who include moderate amounts of soy in their diet. And I would say that accounts for 1 to 2 servings a day. And I also wanted to point out that soy is one of the few plant foods with all the amino acids your body needs to make protein. So the emerging research links soy food consumption with a greater variety of health-promoting bacteria for the gut microbiome. And examples of soy foods would be edamame, soy nuts, tofu, and soy milk. Last slide, please. So these are your key takeaways. I wanted you to know that the American Institute for Cancer Research has 10 evidence-based recommendations for cancer prevention and survivorship. The 2 most important and near and dear to my heart are eat a diet rich in whole grains, vegetables, fruits, and beans, and also be physically active. There are also resources online for ongoing education and support, and I highly, highly recommend you access and recommend the AICR website as a trusted resource for all of your evidence-based information. there are a lot of other good sources out there, but I really, really like this website. They've done a great job. And just remember that lifestyles that align closer to the recommendations are associated with lower cancer risk. By adopting these lifestyle behaviors, you're going to promote antioxidant, anti-inflammatory defenses, assist with metabolic and hormonal pathways, and also improve your gut microbiome. And all of those steps that we take to reduce our cancer risk are also going to help us reduce our risk for chronic disease, such as type 2 diabetes and heart disease. So that's all I had. And if you guys have any questions, I'd be happy to answer any of them.
Thank you so much, Karen. I learned so much all the time. This is great. Yeah, as Karen said, please enter any questions that you have either in the chat or the Q&A, monitoring those. We have a few more minutes left in the webinar, so we want to make sure that that you have your opportunity to ask any questions that you have of her.
So Karen, this is Kristen, and I have one question that I've heard from people in the past, and that is, should people really be focused on like organics? If they're looking to have a really plant-focused diet, do people need to focus on organic produce because, you know, it doesn't have those pesticides?
Right. Yeah, that's a good question. So I think the answer is no. As far as nutrition is considered, I think all conventional and organic they're both going to have the same good nutrition in there. I think if you have the financial ability to afford organic foods or you feel like that the environmental practices that come associated with those, if those align with your values, and again, you can afford them, then organics are fine. But I think all the fruits and vegetables are going to have the same amount of nutrients in them. And especially for me, I work in a rural clinic. And so I have a lot of patients who come from far, far away. And I also deal with a lot of Medicare population. And so sometimes they come with, some financial constraints. So you typically don't, in my practice, recommend that people buy those unless those are things they can afford and they want to afford, because like we mentioned, going back with that weight slide, but, people going through cancer treatment just have so many social determinants of health that we have to consider. So I just think that's really important when you're talking to people, that you just need to take into consideration their social, environmental, and financial resources when you're giving out nutrition advice, because it's just important information.
Thank you for that. We do have one other question. With the advice of limiting alcoholic beverages, are there certain ones that are better or worse for cancer prevention? It's a good question.
Yeah. So I sat in on a webinar with one of the researchers and then the nutrition advisor from the American Institute for Cancer Research. And essentially they were telling us that no, there's not one, as far as alcohol. I know that they say wine is good for heart health. But in this particular situation, what the researcher was telling us was, and if you go to that QR code and you pull up the data, that alcohol's on a lot of those. And so the recommendation right now is just to avoid alcohol in general. And even they said that's kind of a hard one to follow. And so it's just really leaving it up to the individuals to make their own responsible choice. But it is a recommendation because it is a known carcinogen. And so it's all alcohol beverages, unfortunately. So, but what I will say about that is what I like about the senior advisor, nutrition advisor, Karen Collins, her recommendation is always just to go for action and not for perfection. So if you're aligning your values and your behaviors as closely as you can to those 10 recommendations, and maybe you're still within those national guidelines, you know, it's not to say that that's going to produce cancer. So you have to weigh out your life and your choices and just make the best decision for yourself. So that just kind of, it resonated with me, I guess, because it's so true, right? You're not going to prevent all this chronic disease. So it's just trying to be the best person you can be.
I have another question based on my history working in cancer control, and that is that it used to be that organizations would hand out like Ensure, like meal replacement drinks to help people who are in treatment to maintain their nutrition. However, I've heard from other providers that, you know, Ensure is no better than Coca-Cola. So where does the research stand on those sorts of meal replacement shakes, and are there things that people should look for in those um, beverages?
Yeah, that's a good question. I actually use a lot of Ensure and Boost in my practice. I don't really push one over the other, but like I said, that there's a lot. You have to look at the individual and where they're at, and especially going through treatment. That's way different than prevention and survivorship in some ways, because these patients have so many side effects. And so it's hard to get the nutrition in. So if they have somebody who can prepare shakes for them and do all the whole foods, that's fantastic. But if you have a patient who's taking care of themselves and they're 95 years old and it's all the energy they can do to get up and go to the bathroom, you kind of have to look at your patients from an individual perspective and give them the best recommendation you can in the moment. So those are complete nutrition. And I agree that maybe they have a little bit more sugar in them, but generally those patients aren't eating enough and they're not getting in enough nutrition as it is. So they're not living off of these supplements and meeting all of their requirements. So they're usually just using it to supplement what they haven't been able to eat. But there are options on the market now for lower sugar consumption. So your Glucernas, your Boost glucose control. Some of my patients are doing Fairlife or Muscle Milk or Carnation Essentials, things like that. So there are options now, but we really view treatment a little bit different than we have to approach survivorship and prevention, because they're just two different things. They're not really the same. I mean, I will say that I'm always pushing food, obviously, with my patients. But yeah, that's a good question.
Any other questions from anybody else? We're just at the end of the webinar, but we can take time for one more if anybody has one.
It looks like there's a question here about lettuce. Are there differences in lettuce varieties in regards to cancer prevention? Maybe are there, like, in terms of greens and nutritional value?
Yeah, that's what I was thinking when you read me the question. I mean, yeah, you're gonna get some different nutrients, probably in a darker green vegetable than I'm thinking you're probably talking about iceberg lettuce. I feel like iceberg lettuce gets a bad rap though, because you're still getting fiber and you're getting water and you are getting nutrients. You just might not be getting the same nutrition or nutrition profile. So this kind of goes back to all foods, fruits and vegetables can fit in your diet. You just want a variety. So if my patient's only going to eat iceberg lettuce over not eating any vegetable, I'm going to be super happy they're eating iceberg lettuce. But if you can, those dark greens are probably going to get a little bit more nutrition off of them than you would iceberg lettuce. But you still get great fiber, you get water, you get some of the nutrition from those. So it's not a total bust to eat iceberg lettuce.
Looks like, thanks, Kristen, for catching that last question. I totally missed it. So I think that looks like the last of the questions. So Karen, we really appreciate your time and your expertise and sharing this amazing topic with us that we're all trying to learn, and love the tools that you were able to share and the QR code too, just for access to more information. So thank you so much. And we thank everyone for your time today, and we look forward to seeing you on our next webinar. Thanks, everyone.
Bye.